I'm Dr Christos Apostolou. I'm an upper gastrointestinal, pancreatic and liver surgeon working at the Sydney Adventist Hospital. Symptomatic gallstones are common. The prevalence does vary and is particularly increased in ladies older in life. The incidence in men is also increases later in life. It is important to address the symptoms promptly. Even in the majority of cases that do not present in the emergency department, it's important to seek attention from your general practitioner. An ultrasound is a straightforward diagnostic tool with very little or no risk. You really need to focus on preventing any complications which can be severe and lead to debilitation, such as pancreatitis or infection of the biliary tree. The operation this day and age is straightforward, almost always keyhole with very low morbidity and risk. The recovery is expected to be complete and full without any long-term problems, and that includes a normal diet, a normal consumption of all variety of foods after the procedure. So it's really something to be addressed to prevent any significant issues before it is allowed to. So lithotripsy of gallstones has been tried in an experimental setting, unfortunately due to the location of the gallbladder as opposed to the kidney. Whereas, for example, the kidney is set in a solid space with fluid all around it, so the sound waves can be absorbed by surrounding tissues. The gallbladder is lying free under the edge of the liver, adjacent to other air-filled organs such as the colon and the bowel. So the safety profile does not allow for lithotripsy to be performed regularly for gallstones. We're really very limited in dissolving the stones or breaking the stones down in any other way. In other countries, certain doctors do remove the gallstones alone with leaving the gallbladder intact, but we know that is a very short-term solution because more gallstones will form and you're exposing the patient to the duplicate risks. So the recommended treatment for patients with symptomatic gallstones is laparoscopic cholecystectomy. Living without the gallbladder is obviously very well tolerated. It's natural for most patients in this day and age to look at the internet before consulting a doctor, or if they're presenting with that issue and they're going to see a specialist. There is a known very low percentage in the region of 1% which may have some long-term diarrhea-like symptoms which we can treat with bile salts. The remainder of the patients and the vast majority of the patients have no long-term issues and have a completely normal life following gallbladder removal. This includes eating a variety of fats, tolerating alcohol, and having a completely normal diet. So there's no known long-term problems, which is as reflected by most patients that have the gallbladder removed, never look back and think about it, really.